We've been hearing about how Israelis are coping with the experience of October 7th and the war that followed it. And helping some Israelis do just that, cope, is our next guest's job. Last week, I had the opportunity to speak with a specialist in rehabilitation medicine at Rabin Medical Center. Well, Dr. Michael Bahar is director of the Physical Medicine and Rehabilitation Unit at Rabin. And Dr. Bahar, thank you very much for joining us.
Thank you for having me.
To what degree have the events of the past year and a half or so affected the number of patients, the number of people you're seeing at Rabin?
Enormously. Rabin Medical Center had a crucial role in the response of Israel to the war, and we saw a very high number of war injuries and war casualties that arrived to be treated at the hospital. We're talking about around 1,200 soldiers who were injured during the war, who was treated at Rabin Medical Center at Petah Tikva as a total, and many of them proceed to rehabilitation services in the hospital as well, but definitely very significant and high numbers of casualties.
I wonder if you could tell us what types of treatment are typically given and what kind of specialized medical staff is on hand to give it.
Of course, as a rehabilitation department, the clinical approach is very multidisciplinary, and the medical staff, the specialized medical staff of the department includes PM&R specialists, doctors, nurses, physical therapists, occupational therapists, speech therapists, psychologists, social worker, nutritionalist, all work combined and together in order to achieve the functional goals and rehabilitation goals of the patients.
What are the most common injuries that you're treating?
The department treated mostly war injuries during this period, the year and a half that it's been working. And what we see most of all is war injuries. It includes blast injuries, shrapnel, gunshot wounds, traumatic brain injuries, and we see a lot of injuries from the emotional part on acute and post-traumatic stress disorders. It's a lot of the injuries that we see.
We read in the Times of Israel about a patient of yours being treated by your unit, that is a young soldier named Eitan. Do you know his story?
Of course, I know. I treated him for almost 3 months in the department. Eitan is an extraordinary and brave Israeli soldier, and he suffered a complicated injury, multi-trauma injury. I won't go into details, obviously, but he did a wonderful rehabilitation process. And I'm glad to share that he was discharged from the department 2 weeks ago, overall in a good condition. And it's been a real privilege to treat him. He's an amazing young man.
What when you say he's an amazing young man, what sticks with him?
He was one of the patients that had such a charisma and such a positive approach, even though he was, as I said, he had a complicated situation, medical situation, but his charisma and all this good vibe that he brought to the department actually influenced other patients in the other soldiers, other wounded soldiers in the department to go on and to do better in the rehabilitation process. It was really amazing to see.
It's not a common medical term, charisma, but it has an effect on patients surrounding him.
A lot. And we actually see our department is relatively small. We're talking about 14 inpatient beds. And you see the power of the group, of these soldiers who were injured, suffered different injuries, but working together to achieve the rehabilitation goal. And you see how they influence one another. It's really amazing to see. And I think it had a very positive effect on the rehabilitation process of these soldiers.
The American Friends of Rabin Medical Center, which produces this series of panels, donated an exoskeleton, obviously a synthetic exoskeleton that helps semi-paralyzed patients to walk. Can you tell us about the device and about Shahar, the first patient to actually use it?
Of course. Shahar was the first patient in Israel ever to receive the Rewalk device. It's as you said, it's an exoskeletal motoric device that enabled Shachar, that had a spinal cord injury and was paraplegic without the ability to move the lower limbs. He was able, with the rehabilitation process that he did in the department, where we trained him how to use the device, at the end, he was discharged about a week ago from the department after he achieved functional gait with the device, outside, ability to walk as any other person, and it was truly amazing to see.
You've announced a partnership with Rabin Medical Center's Innovation Lab that includes the application of artificial intelligence, or I assume the further application of artificial intelligence to rehabilitation. What kinds of applications do you hope to see just over the horizon?
Yeah, so we're actually already working on developing several AI instruments. We know that AI is in many senses the future of medicine and rehabilitation medicine in specific. And we're working on two main areas. One of them is the cognitive assessment level of patients. We will be able, with an AI instrument that we're developing, to organize all the various cognitive assessments that we're doing for the soldiers in order to achieve a better review of the cognitive situation. And another very interesting thing that is being developed is the ability to create, we create an AI assistant who is able to identify those who are at larger risk to develop post-traumatic stress disorder based on a chat with the patient. It's very exciting. It's very useful for the rehabilitation treatment, and we're working on it.
You know, there's a conversation, sometimes an argument that takes place in the United States about our Veterans Administration hospitals and the idea of special institutions that are for veterans. And those institutions, while they may have problems, are very often extremely popular with the veterans, who find the company of other veterans in treatment to be extremely important. And I just wonder, you have a small unit, but if you have all soldiers in there at any given time, is there some important unit cohesion that you experience?
As I said before, the power of the group of soldiers working together for the rehabilitation goals was very, very impressive, and it influenced a lot the functional outcomes of the patients treated in the department. We see it, they give each other strength. It's easier for them to communicate with people who suffered similar injuries and are facing the same kind of process with the difficulties, with all the various injuries that they suffered, and it gives them a lot of strength. And we see it in the positive results and the good results that we see in the rehabilitation processes in the unit.
And you've mentioned post-traumatic stress disorder.
Yes.
Is counseling and therapy, is that an important element to psychotherapy of what goes on?
It's in the center. It was in the center of our activity and treatment since day one. Okay, and we implemented a lot of different instruments and therapies in order to face this situation. We understood that these young soldiers who arrived to us, all of them suffered a major traumatic event. Okay, this injury is always very traumatic. So we first of all, we have a psychologist in-house in the department, that every patient is being treated. That's not the baseline care at the rehabilitation department, but in the rehabilitation department in Bellinson at Rabin Medical Center, all of them receive personal psychological treatment. We also implemented group therapy for the soldiers. We implemented virtual reality devices, okay, with dedicated programs of mindfulness and other therapies that were very useful. In all of them appear, a lot of them appear as acute stress disorder, and our main goal is to avoid the acute stress disorder to develop into PTSD, into post-traumatic stress disorder. Exactly. So virtual reality, and we work closely with the psychiatry wing of the military in order to give them the ongoing treatment after they're being discharged from the department.
I want to ask you just one last question that
Yes.
it really doesn't relate to your specific role at the hospital, but just your life as an Israeli. As you said, it's not just the soldiers who've experienced traumatic, but the country
Yeah,
has experienced a
I
traumatic
agree.
time. And I'm just wondering how you deal with the memory of that of those events from October, and are they still with you? Those memories?
All the time, all the time. I think that all of us, all of the country went through something big, something that we will still need to process. It's obvious that we're still in the doing part of the response. We're very busy in the response, in the day-to-day work and activity. And I'm sure that the time will arrive that all of us will need to just have a little break and begin to process what we've been through. It's
Yeah,
very complicated for sure.
here's hoping.
Yeah.
Dr. Michael Bahar, Director of Physical Medicine and Rehabilitation at Rabin Medical Center in Petah Tikva, thank you very much for joining us for this recorded interview today.
Thank you, Robert, for having me. It was a pleasure. Thank you.